Hello there, how are you feeling today? Have you ever felt completely exhausted without knowing why? Even though you are still following your meal plan, still taking your medication regularly, still checking your blood sugar every day, your body seems to get weaker. You feel tired more easily. You become more irritable. You have trouble sleeping. Or even worse, a small wound might take a whole week or even an entire month to heal. If that image feels familiar, the problem may not be your medication or your diet. It may come from something much quieter but extremely important, a deficiency in essential vitamins and minerals for people with diabetes. Just imagine this. One morning, you wake up and try to get out of bed like usual, but your legs feel numb and painful. You have to call someone in your family to help you stand up. Because of small deficiencies in your body, your quality of life can be deeply affected, and no one may have told you about it. Did you know that, according to studies, nearly 40% of people over 50 with diabetes are lacking at least 3 important micronutrients? And this does not just make your blood sugar harder to control. It can actually speed up complications affecting your heart, your nerves, and even your eyes. The good news is, you can do something about it. In today's video, we will explore the top 3 essential vitamins and minerals that everyone with diabetes should pay close attention to. This is not a random list. These are nutrients that have been studied and confirmed through research from trusted universities like Harvard, Tufts, and McMaster. So, do not leave just yet. Please stay with me for a little while. Let us listen together to how your body may be quietly calling for help. Because sometimes, a simple change in your daily meals or the right supplement can become a powerful turning point for your health. Vitamin E, the cellular shield that protects nerves in the body from free radicals and diabetes. Dear friend, you may have heard of vitamin E as a beauty vitamin that benefits the skin. But few people know that for individuals with diabetes, vitamin E truly acts as a biological shield. It protects your body from a wide range of dangerous complications, including those affecting your eyes, heart, nervous system, skin, and immune function. Inside your body, vitamin E works as a powerful antioxidant that neutralizes free radicals. These are unstable molecules created through glucose metabolism, prolonged stress, or chronic inflammation, all of which are common in diabetes. If not properly managed, free radicals can severely damage the walls of small blood vessels, nerve cells, and even the DNA within your cells. When blood sugar levels are high, oxidation increases significantly. This means people with diabetes need more vitamin E than usual because the body constantly battles against the destructive effects of free radicals. However, if your vitamin E levels are insufficient, this protective barrier becomes weak. As a result, nerve cells are damaged, blood flow becomes irregular, kidney inflammation can worsen, and aging processes speed up. So what are the signs of vitamin E deficiency? You may first experience unexplained fatigue, dry or irritated skin. You might notice a slight decline in your vision, especially at night, or symptoms like watery eyes or blurry vision or difficulty focusing while reading. Some people feel their hands or legs becoming weak, slightly trembling, or losing sensation in the fingertips or struggle to grip small objects. All of these are signs of peripheral nerve damage. Vitamin E is also closely related to heart health. It helps keep blood vessel walls flexible, preventing cholesterol plaques from building up. This reduces the risk of high blood pressure, stroke, and heart attacks, all of which are common complications in people with long-term diabetes. When vitamin E is lacking, blood vessels may become stiff, narrow, and blood flow to essential organs, like the kidneys, eyes, and brain, can be severely restricted. In the immune system, vitamin E enhances the activity of white blood cells, the frontline defenders against viruses and bacteria. If you find yourself catching colds easily, taking longer to recover, or dealing with recurring infections, your body may be running low on vitamin E without your knowledge. Especially for people with diabetes, it is common to experience slow-healing wounds, persistent skin ulcers, or infections in the feet. One reason behind this is a lack of vitamin E, which is essential for skin tissue repair, inflammation reduction, and restoring skin elasticity after injury. The good news is that it is not difficult to increase your vitamin E intake if you know how to choose the right foods. Natural sources rich in vitamin E include sunflower seeds, almonds, hazelnuts, avocados, spinach, broccoli, and wheat germ oil. For example, just 28 grams of sunflower seeds, about a small handful, can provide nearly 80% of your daily vitamin E needs. 1 tablespoon of wheat germ oil can offer up to 100% of the daily requirement. Additionally, Fish like salmon, mackerel, and sardines contain both vitamin E and omega-3 fatty acids, a powerful pair that supports heart health and reduces inflammation. Dishes like grilled salmon with stir-fried greens and olive oil, sunflower seed salad with avocado and spinach, or pureed broccoli soup made with unsweetened plant milk are not only delicious and rich in vitamin E, but also easy to prepare. If your diet is not enough, especially if you have fat absorption problems due to digestive disorders or autonomic neuropathy, your doctor may recommend vitamin E supplements. The recommended dose is usually between 200 and 400 international units, IU, per day. The natural form, D-alpha tocopherol, is preferred because it is better absorbed than synthetic forms. However, high doses must be prescribed with caution because vitamin E is fat-soluble. If taken in excess, it may interfere with blood clotting. It is important to take vitamin E along with healthy fats, so it is best consumed during meals that include olive oil, avocado, or fatty fish. Maintaining stable blood sugar levels will also help your cells use vitamin E more effectively and prevent it from being lost through urine. Vitamin E may not be as widely discussed in diabetes care, but when it is lacking, the consequences affect the nervous system, cardiovascular health, skin, vision, and immunity. On the other hand, when taken properly, it becomes a loyal companion in maintaining lasting health, resisting inflammation, and keeping your body strong, youthful, and resilient each day. Magnesium, the nervous system. Mineral that stabilizes blood sugar and restores whole body health. Dear friend, if you often feel tired, experience nighttime leg cramps, or occasionally notice a rapid heartbeat without a clear cause, then you should pay attention to one often overlooked but vitally important element: magnesium. For people living with diabetes, magnesium is not just an ordinary mineral. It is a key companion that helps regulate blood sugar, maintain a steady heartbeat, prevent nerve damage, and support hundreds of biochemical reactions throughout the body. First, it is important to understand that magnesium is present in nearly every cell, including those in your muscles, heart, brain, and kidneys. It participates in over 300 enzyme systems in the body. It helps transport calcium, regulates insulin levels, and facilitates the movement of glucose into cells. Without sufficient magnesium, insulin cannot work properly. Blood sugar levels become unstable, and you may feel exhausted both physically and mentally. What is concerning is that more than 60% of people with type 2 diabetes are at risk of magnesium deficiency without even knowing it. This is because the symptoms are often mistaken for general signs of diabetes: fatigue, anxiety, numbness, insomnia, muscle cramps, or irregular heartbeat. So why are people with diabetes more likely to lack magnesium? First, when blood sugar is high, the kidneys work harder to eliminate excess glucose from the blood through urine. But during that process, large amounts of magnesium are also lost, just like nutrients being washed away by a fast-flowing stream. Each time you urinate more than usual, your body loses magnesium quietly and steadily. Second, insulin, the hormone that regulates blood sugar, needs magnesium to function correctly. If magnesium is lacking, insulin cannot bind effectively to cell receptors. As a result, glucose stays in the bloodstream instead of entering the cells to produce energy. This condition is known as insulin resistance, the leading cause of type 2 diabetes. In addition, medications commonly used by people with diabetes, such as diuretics, blood pressure drugs, and metformin, can lower magnesium levels over time. The longer these medications are used, the greater the risk of deficiency. So how do you know if you are low in magnesium? The most common early sign is nighttime leg cramps, especially in the calves or feet, because magnesium helps muscles relax and contract properly. You may also experience muscle tightness, minor twitching, or eyelid spasms, symptoms that are rarely linked to magnesium deficiency. If you have trouble falling asleep, frequent dreams, or wake up in the middle of the night without explanation, your nervous system may be affected by a lack of magnesium. Regarding heart health, low magnesium can cause your heart to beat rapidly, feel fluttery, beat irregularly, or raise your blood pressure unexpectedly. These are serious warning signs, especially in people with diabetes who already have risk factors for cardiovascular disease. Magnesium also protects your blood vessels, helps prevent atherosclerosis, and reduces chronic inflammation, a major cause of diabetic complications. It supports your kidneys by preventing calcium buildup in the renal tubes, thereby reducing the risk of kidney stones and progressive kidney disease. In the brain, magnesium promotes the production of GABA, a neurotransmitter that calms the central nervous system, improves mood, and reduces anxiety. Therefore, magnesium deficiency is also linked to feelings of tension, irritability, and mild long-term depression in people with diabetes. So how can you supplement magnesium effectively? The good news is that magnesium is abundant in everyday foods. The best sources include leafy green vegetables like spinach, amaranth, and kale, nuts like almonds, cashews, and pumpkin seeds, legumes like black beans, mung beans, and soybeans, whole grains such as oats and brown rice, and fatty fish like salmon and mackerel. For example, one small handful of almonds, 28 grams, provides about 76 milligrams of magnesium, which is around 20% of the daily requirement. 1 cup of boiled spinach can provide nearly 80 milligrams. A 100-gram serving of grilled salmon can provide 30 to 40 milligrams of magnesium, along with heart-healthy omega-3 fatty acids. If your diet is not sufficient, especially in older adults with poor absorption or those following strict diets, your doctor may recommend magnesium supplements. The most easily absorbed forms are magnesium glycinate, citrate, or malate. The usual dose ranges from 200 to 400 milligrams per day, depending on your health condition. Note that magnesium should not be taken at the same time as high doses of calcium, as the two minerals compete for absorption. It is best to take magnesium in the evening before bedtime to help relax the body and support deep sleep. And one final reminder, good blood sugar control is essential for magnesium to be effective. If your blood glucose is too high, magnesium will still be lost through urine. Therefore, you must combine 3 elements. Consume enough magnesium, supplement when necessary, and maintain stable blood sugar through a healthy lifestyle. As you can see, magnesium is not just a hidden name on nutrition labels. It is a vital key that helps insulin work better, strengthens the nervous system, keeps the heart healthy, and improves sleep quality. With just a little more attention, magnesium can become your trusted ally in the journey to prevent diabetic complications and support long-term wellness. Zinc, the tiny yet powerful mineral that supports blood sugar control and healing. Dear friend, when it comes to essential nutrients for managing diabetes, zinc is often not mentioned as frequently as vitamin C, vitamin D, or magnesium. But in truth, zinc is a silent hero. It plays a crucial role in insulin production, inflammation control, immune support, and tissue healing. What is concerning is that many people with diabetes suffer from zinc deficiency without even realizing it. Why does this happen? When blood sugar is high, your kidneys must work harder to filter glucose from the blood. During this process, zinc is also eliminated through urine. The more frequently you urinate, the more zinc your body loses. At the same time, insulin resistance, a hallmark of diabetes, also weakens the body's ability to absorb and use zinc effectively. Moreover, common medications used by people with diabetes, including diuretics, blood pressure medications, and metformin, all contribute to a gradual decrease in zinc levels over time. So what happens when you are deficient in zinc? You may notice that you catch colds more easily, suffer from minor infections that last longer, or have small wounds like scratches or foot ulcers that take weeks to heal. This is because zinc plays a central role in immune function and collagen synthesis, both of which are essential for tissue repair. Another surprising sign of zinc deficiency is an intense craving for sweets. Why? Because zinc helps regulate taste and influences the brain's appetite center. When zinc is low, you may struggle to resist the urge to eat sugary foods, a dangerous situation for someone managing diabetes. Zinc is also deeply involved in nervous system health. When zinc is lacking, symptoms like nerve pain, tingling, or sensory disturbances in the hands and feet may worsen, common signs of peripheral neuropathy. In addition, some people experience loss of taste or smell, increased hair loss, brittle nails, inflamed skin, redness, or small white spots on the skin. For men, zinc deficiency can affect testosterone production and fertility. For women, it may cause irregular menstrual cycles, chronic fatigue, and reduced libido. Over time, this deficiency can also impair insulin production, making blood sugar levels rise more easily, even when the diet remains unchanged. At the cellular level, zinc is a major component of the glucose tolerance factor, a substance that helps insulin bind to cells more effectively. When zinc is lacking, this process is disrupted. As a result, glucose remains in the bloodstream instead of being delivered to cells for energy production. That is why several studies, including those conducted at Tufts University and published in the American Journal of Clinical Nutrition, have shown that regular zinc supplementation can significantly improve insulin sensitivity, reduce fasting blood glucose, and even lower HbA1c, the key indicator of average blood sugar levels over 3 months. So how can you ensure proper zinc intake? The good news is that zinc is found in many familiar everyday foods. The best sources include beef, chicken, organ meats like liver, and seafood such as oysters, crab, and shrimp. Nuts and seeds like pumpkin seeds, sunflower seeds, sesame seeds, and cashews also provide excellent amounts of zinc. For example, just 3 small oysters can provide over 200% of your daily zinc needs. A 100-gram serving of lean beef gives about 40%, and 1 tablespoon of roasted pumpkin seeds offers nearly 25% of the recommended intake. If you follow a vegetarian diet, do not worry. You can still get zinc from chickpeas, lentils, chia seeds, oats, and unsalted mixed nuts. However, remember to soak or cook beans and seeds thoroughly because they contain phytates, substances that reduce zinc absorption if eaten raw or not properly prepared. In cases where your intake of animal protein is low or you show clear symptoms of zinc deficiency, your doctor may recommend zinc supplements. The most absorbable forms include zinc picolinate or zinc bisglycinate. A common dosage ranges from 15 to 30 milligrams per day. However, higher doses should be monitored carefully because excessive zinc can interfere with copper absorption and cause nutrient imbalances. Remember, zinc supplementation is only effective if you also maintain stable blood sugar levels. If glucose in your blood is consistently high, zinc will continue to be lost through urine. Also, avoid taking zinc at the same time as high-dose calcium, as they compete for absorption. Lastly, you must remember that the body cannot produce zinc on its own, nor can it store large amounts of it. That means your daily diet must supply enough zinc to meet your needs. With just a few small adjustments in your meals, you can help your body recover from within, improving immunity, healing wounds, reducing inflammation, and stabilizing blood sugar naturally. For people with diabetes, zinc is a humble but powerful micronutrient that strengthens your body, brings peace of mind, and supports your health each day as you manage the condition. Dear friend, if you have listened all the way to the end of this video, I truly believe that you genuinely care about your health, and that is something truly admirable. Life with diabetes is not easy. It requires us to be careful with every meal, every hour of sleep, and every step we take. But that does not mean you must live in fear, limits, or pain forever. The solution does not lie in perfection. It lies in small, consistent actions every single day. Today you have learned more about the roles of vitamin E, magnesium, and zinc, nutrients that may seem simple but are actually the key to helping insulin work more effectively, protecting your nerves, and allowing your body to heal itself from within. If you start with just the small things, a meal rich in leafy greens, a handful of sunflower seeds instead of a sugary snack, a gentle morning walk, or a properly dosed supplement, then you are laying the first bricks for a healthier body, a more stable life, and a calmer mind. I sincerely hope that you will not only watch this video but also apply it to your daily routine. And remember, the journey to managing diabetes is not a lonely one. We can move forward together, through each video, through every piece of scientific knowledge shared, and through the heartfelt comments that you leave below. If you found today's message helpful, please do not forget to give this video a like and subscribe to the channel so you will not miss the next ones. And if you are already using any of the vitamins mentioned in this list, feel free to share in the comments below. I am always here to listen and walk beside you. Wishing you good health, peace of mind, and steady control over the challenges you are facing. I look forward to seeing you again in our upcoming videos.